My name is Deb Harcroft, and I'm with the National Disability Services Safer and Stronger program. Today, I'm speaking with three of Victoria's COVID-19 disability sector vaccine champions, disability advocates Tricia Maloney and Uli Kaplan, and House Supervisor in Regional Victoria, Peter Romer. Welcome, everyone, and thanks so much for joining us today.
No worries. Thank you for having me.
Thank you.
Thank you for having me.
To start off, would you please tell us a bit about yourselves and what you do and why you all became involved in the Vaccine Champion program?
Well, I work in disability in a group home with 6 adults who have all, like the rest of us, all been affected by COVID, the lockdowns, the restrictions.
I'm a 26-year-old, spent most of my life in hospital. Why did I become involved in the vaccine program? Because I was very frustrated and very annoyed, blamed multiple governments, then realised that it was no one's fault. And, we're all trying to do the best we can.
I contracted polio at the age of 4 months because there wasn't a vaccine available. So once the vaccine was introduced, we no longer had polio in Australia once everybody got vaccinated. So vaccination has always been part of my thinking.
I was initially hesitant to get the vaccine for no real particular reason that I knew of, but phobia of needles was definitely one of those.
With the COVID-19 vaccination rollout, we have been seeing hesitancy and fear and a lack of urgency, which we haven't seen to this extent with the other vaccinations we've received over our lives. Can I ask, why was getting a vaccination important to you? And was there anything in particular that influenced your decision to get a vaccine?
I think there's a number of things that influence that. I have elderly parents, so I would like them to be able to have a bit more freedom, but I also want to make sure that they're safe.
I just had faith. I just had faith in the system. I trusted the system. I was nervous. I was skeptical. I'm not going to deny that I wasn't. Very simply, I do not want to see the repercussions or the damage that I would do to myself if I didn't get the vaccine.
We have a lot of children in our family, children with disabilities as well. We want to make sure they're safe.
Being in the age group I am, so I'm 33, so early 30s, and I kind of really had no more reason not to get it.
After making that decision, how did you find the process of getting your vaccination? And I wonder, from listening to your stories, if you have any tips for people who are still waiting to make a booking, or what people can do to make sure their booking goes smoothly, and in particular, for people with disabilities.
Well, for me, it was relatively easy because I actually got filmed having my vaccination because I wanted to talk to people with intellectual disabilities about why I was getting vaccinated.
Honestly, I know this might sound funny to some people, but I literally rolled out of bed at 9:15, walked into my lounge room with no top on, sat in a chair and got a needle. That's all it is. Yes, there were side effects. A little bit, got a headache, a ridiculously short and sharp headache. It was very painful, but it didn't last long. Had a bit of a sore arm, felt like someone punched me in the arm.
I didn't actually feel the needle at all, where others, my colleagues, they come back saying how much they felt the needle, but I didn't feel anything. I think it was good. I was quite upfront with the people at the state clinic in Bendigo.
The process was quite smooth, so I have a couple of allergies. My GP came out and said, I better talk to you before we have the vaccination. And I said, okay. And he said, what's these allergies? I said, it's on your list. And he went, oh, yeah, that's right. No, they won't affect it. So that was fine. So that was easily done. It was very easy to get it done. I booked my second vaccination in at the same time, came back to the same doctor's surgery and got vaccinated straight away.
As a vaccine champion, how can you help people who have family and friends and co-workers who are anxious about the vaccines or getting information that is false? What do you suggest that they could do to help build confidence in the vaccines?
It's important to try and help people find their way, but not to the extent where you know, can potentially lose friends or family over it. And that's an important thing that I might not have thought about at the beginning.
But if you were to get it, do you just go to your GP? You know, even if you want to have a sit down and just speak to them about your concerns and come back in a couple of days and then have the vaccine. Just explore the conversation.
But I also talk to people about their fears. What is it that you're afraid of? And I tell them, I've had the vaccine myself, but you have to make your own decisions, but you have to do it with the right information.
But use the supports around you. Talk about it. And if you're going to go anywhere and look for information, go to the Victorian government website. But yeah, I'm not saying go get it. I'm not going to pretend like I have all the answers, but I would seriously think about it.
Thank you so much, Trish, Uli and Peter, for taking the time to speak with me today and sharing why it's so important that we should take up the opportunity to get a vaccination.
No worries. Thank you.
No problem.
Absolutely. And thank you for the opportunity to spread the message.
If you are 12 years or older, you can get a COVID-19 vaccination at a state vaccination clinic, a GP, community pharmacies, or even drive-through and pop-up clinics. You can go to the Vaccine Clinic Finder at www.health.gov.au to find where you can get a vaccination near you. And if you want more information on the Vaccine Champions program, you can email Sarah Anderson at sarah.anderson@health.vic.gov.au or go to the Victoria COVID-19 Hub Toolkit on the NDS website at nds.org.au.